Black people in UK 4 times more likely to die from COVID-19. The UK's Office for National Statistics found that Black people are more than 4 times more likely to die from COVID-19 than white people. The difference is supposedly not only due to pre-existing differences in wealth, education, living arrangements, and health. After the researchers considered age, disability, and other socio-demographic factors, they found that Black people were still almost twice as likely as white people to die from COVID-19. Chinese and mixed ethnic groups had a COVID-19 death risk similar to that of white people, while Bangladeshi and Pakistani males were 1.8 times more likely to die from COVID-19 than white people. Bangladeshi and Pakistani females were 1.6 times more likely to die from COVID-19 than white people. The Office for National Statistics said, these results show that the difference between ethnic groups in COVID-19 mortality is partly a result of socioeconomic disadvantage and other circumstances, but a remaining part of the difference has not yet been explained. According to The Guardian, minority groups face the greatest risk from COVID-19. Race equality think tank Runnymede Trust Deputy Director Zubaida Haq said, factors like racial discrimination and racial inequalities are important but are not taken into account in most statistical modeling of COVID-19 risk factors. For instance, 30% of Bangladeshi households, 16% of Pakistani households, and 12% of Black households experience overcrowding from 2014 to 2017. These same minority groups are also more likely to work as frontliners in England's National Health Service, with 21% being from ethnic minorities. Joseph Rowntree Foundation Acting Director Helen Barnard called the figures, which cover deaths from March 2 to April 10, a stark reminder that although we are all weathering the same storm, we are not all in the same boat. She said it doesn't have to be like this. As a society that prides itself on justice and compassion, we can and must do better. The US has also reported data on African American deaths, with 33% of all hospitalized in the country being African American, despite making up only 13% of the US population. In the city of Chicago, African Americans make up 68% of coronavirus deaths. The BBC reports that rumors have been circulating since late January that Black people may be immune to COVID-19. However, there is no evidence that complexion has anything to do with COVID-19 immunity.